guys, it's Azusa. Welcome back to my channel. So today I'm gonna be talking about NBDE Part 2. Well, actually, I was not sure if I'm gonna talk about this topic because I took Part 1 and Part 2, and this exam will be discontinued near future, and INBDE, which is a new exam, has already started. So I don't know how much helpful information I can give you guys, but anyway, I guess 50% of my subscribers are foreign trained dentists who are looking for information, whatever it is. So anyway, let's talk about it. Alright, so I already talked about Part 1 in my previous video, so if you're looking for Part 1 information, please check that out. And Part 2 is clinical examination. So it has endo, operative, oral diagnosis, which is like pathology and radiology, and ortho, pediatric, perio, pharmacology, patient management, and pros. Is that it? Yeah, I think that pretty much everything. So this is 2 days examination. The first day, you're gonna get 400 questions. It's an all single question, multiple choice. You're gonna get 3.5 hours for first 200 questions, and lunch break, and after lunch break you're gonna get another 200 questions. And also day second, you're gonna get 100 case-based questions. This is the basic component of the Part 2. First of all, how much did I study? If you ask this question to dental student in the States, they're gonna answer like, I study like 2 to 3 weeks before the exam, or sometimes you're gonna get crazy answer like, I study only 3 hours. But don't trust them if you are foreign trained dentist. I would say I spent 6 months to study for this exam just for Part 2. First 4 months, I was studying kind of on and off. I was not that serious. I started from dental decks. Like, I decided I'm gonna start like 30 cars per day. It takes like 2 to 3 hours. But I didn't study constantly. I stopped studying like a month and I started to doing again. Last 2 months was very serious. I studied like 8 to 10 hours per day. So what I can tell you as a foreign trained dentist is you have to be trained specifically for this exam, American board exam. What I mean by that is, for example, if question asks, this is example, you're gonna deliver anterior crown on upper teeth, like number 8. On the day of the delivery, you notice that shade and color is not matching for your patient. What are you gonna do? So I would answer, I'm gonna retake shade and color and bring them back to the lab and remake it. That is the answer I would choose. But actually the answer is do whitening for other teeth. That is the correct answer for this exam. I was so confused because in my country, minimal intervention is the first priority, but whitening other teeth, remake the crown, both of them can be correct in a clinical situation. So you have to train which is prioritized in American board. Did you see what I mean? So that's why I think you need to get familiar with what is American board. Okay, let's talk about how I prepared for the test. I started from dental decks, and honestly, I shouldn't have done that because the information on the dental decks is very random. It's not organized. So I feel like I just waste my time to study. And then I started to watching YouTube video called Mental Dental. I don't remember, but I guess it's Mental Dental, I'm sorry. It was very, very good YouTube channel. It was very organized, and I think I watched 90% of his channel, and I made a note from that lectures, and it was really helpful. Thank you so much. And also I studied Motsby. This one for Part 2. I didn't use this for Part 1, but I've heard, especially the which one was that? Yeah, patient management is very good for this exam. And I was not sure what is the patient management. And this is more like American law or how to treat patient, like how to get informed consent, or like they're talking about CDC or FDA, IHS, NIH, or stuff like that. Some of my friends said to study patient management, this book is very good. But actually I used this book as a kind of dictionary. This is a very good book. But if I read this book now, after I finish the all exam, I understand this book is very helpful to review my knowledge. But I would say this is not the book you're gonna read for the first time when you started to study. And also I did ASDA papers, which is the old past questions. For part 1, there are tons of questions, but for part 2, there are only like 4 official ASDA papers. So you can go through every single questions, and which is very helpful because actually on the exam day, you will find some questions are from past questions. So what I recommend you to do is start from Mental Dental YouTube channel, which is very helpful, and make note like this. You know, I like to make little handy notebook like this and review it over and over. And this is, you're gonna get foundation for this examination, and do that as the papers. And for me, weak point was pharmacology, so I went over Tufts Pharma, and it takes like 2 weeks to complete, understand, and remember everything on the file. It was just like 40 to 43 pages, but it has a lot of information, and all informations are very important. And also for part 2, you have to be familiar with X-ray, like PA or PAN or whatever. So I went over this kind of book. This is from my university. You don't have to use this book. This is my Japanese book, which I studied when I was dental school. I used this book more than 10 years ago, but it has a lot of, you know, X-ray sample and questions. And also I used this kind of book, which is also from my university, and it has a lot of, you know, pathology, radiology, and oral maxillosurgery this is just the pictures. And this is from my dental school. So when I was dental school, I already went over this book like more than 50 times. I thought I forgot everything after I graduated because I don't use this kind of, you know, knowledge in a clinical situation that much. And when I opened this book, I noticed that it's much easier to do same book which you already used before. I recommend you to see pictures from this kind of material like X-ray, pathology pictures. But I don't recommend you to go over all your dental school material like post, perio, endo. You don't have to do that. But the material I study for my country's national board needs a lot of deeper knowledge. And NBDE Part 2 is not that kind of question, not that kind of exam. It's hard to explain, but you can tell that once you go over the ASDA papers or whatever past question, you can definitely tell that they have a tendency how to ask, where to ask, what kind of field they likely to ask on the exam. So you don't really have to remember every single words from your textbook. What I wanted to say is just do past exams over and over and remember everything on the ASDA papers or whatever past exam. And last of all, the quality of X-ray is terrible. But don't be panicked out. It was not only you getting that worst quality pictures. Everyone is getting same quality X-rays, so it's not only you. All right, so enjoy your study, and I'll see you again. Bye.